in every part of our lives, from your social media algorithm to what you eat or how you get to work. And there's still plenty of fear that it's going to replace human beings. But in the rural Free State, a remarkable innovation is assisting, not replacing, overstretched medical professionals and helping their patients receive better care.
It's the brainchild of a young doctor who saw the familiar problems of our state medical system. Not enough resources, too many patients, and too few doctors. Her response: a digital assistant that can bring the doctor into the room with the patient even when she's hours away. I traveled to the Free State to see an invention in action. Dr. Leonie van der Merwe lives on a farm in the Free State. Every morning, she makes the 14-minute journey to her practice in Hoopstad, near the Bloemhof Dam. She left Pretoria 2 years ago to settle here, in a region better known for maize production than medical care.
To us, the closest private hospital is in Malcolm, which is 100 kilometers away. Most people prefer Bloemfontein, so they drive 200 kilometers, and then in the middle of the month, no one has money, then they're struggling. There are not enough doctors, and because of that, many nights the hospital doesn't have a doctor on call. Okay, 110 over 60, it looks very nice.
Recognizing the challenges in public health care, especially in rural areas, Dr. Leonie did what the area's farmers are famous for. She made a plan. Across the world, tech companies are racing to bring artificial intelligence into medicine. But here, in the rural Free State, it's not about robots replacing doctors. The challenges are much simpler. What if the patients are here, but the doctors are somewhere else? Patients like 71-year-old Nokwanza Tsotsotso bear the brunt of our under-resourced healthcare system. She suffers from emphysema, and the nearest doctor is hours away. Technology is ensuring Nokwanza's walks are as short as possible. Dr. Leonie is one of only 2 GPs in Hoopstad, and specialists are far away. Hello, how are you? Thank you so much for having us.
The doctor is expected to do everything. So, I think when you're sitting in Sandton, it's very easy to just refer to ear, nose, and throat. But yeah, if you're going to refer to a surgeon, you know that your patient has to drive 200 kilometers. And I just wish there was a way that there was a doctor in every room.
Waiting for government to send more doctors wasn't a solution. So the 30-year-old rolled up her sleeves and took up coding as a side hustle. The idea wasn't to replace doctors, but to enable nurses to work more effectively.
Many of the towns have clinics that only have nurses. Nurses are, the backbone of our healthcare system, and I don't think they're always very well supported or represented.
Dr. Leonie's uniquely South African solution is called Prime, an AI-assisted healthcare system that supports nurses and connects every consultation to a supervising doctor.
Prime stands for Predictive Response Integrating Medical Expertise, and I wanted to just scale the clinical decision-making of the doctor so that when a consultation happens, the red flag can just be picked up and escalated more quickly and more appropriately.
So, how was Prime actually created?
I started working on Prime in 2024. We are 2 doctors working on it. We've given direction and we are coding ourselves as well, but yeah, the software developers are doing the back.
AI can absorb and process enormous amounts of medical information much faster than any human being.
When I was studying, you have about 7 weeks to learn a textbook, and the textbook is like this thick. When we were busy with our model, you can upload a textbook and it's understood and it's in the memory within 40 minutes, which is very impressive, and it just shows you that you're not competing with the AI. The AI needs to be a tool that you're using.
That speed is part of what makes Prime so impressive, and it's designed to guide healthcare workers every step of the way. Nurses in rural clinics make difficult decisions every day. Prime doesn't remove them from the process. Instead, it pushes support into the room even if the doctor isn't physically present. Prime searches for patterns, highlights concerns, and generates suggestions for a doctor to review. Every decision still rests with a human doctor.
So this patient came in and it gives you a sonography history, a runny nose, cough, sore throat and fever. And this consultation happened in the patient's language. It's just a translation through to us. To show the complete transcription, what happened between the patient, and then finally the treatment plan.
The AI suggests a diagnosis and a treatment plan.
So this is live. So directly after the patient has been completed through the system by the nurse, it pops up here and I can review. And less than a minute, we can check, is this appropriate or not?
Globally, AI is already helping doctors care for patients. Dr. Leone believed it could do the same in rural South Africa. To put Prime to the test, we traveled to Wesselsbron, a farming town known for some of the largest grain silos in the southern hemisphere. But not a single doctor. Nokwanza is here for a checkup. Instead of the trip to Bloemfontein, she'll be examined by Sister Itumeleng Mutsisi and Prime.
Every time I give it information, then it guides me.
As Nokwanza describes her latest symptoms, Prime listens through a microphone and translates her responses in real time.
Nurses are clinicians. They make their own diagnosis and they treat patients. Okay. They have done their part, but now they need a doctor's intervention. That's the frustrations they are facing every day.
Sister Itumeleng uses a digital stethoscope to transmit Nokwanza's vital signs directly to Prime. It's faster and more accurate.
Everything looks good with the heart.
As the consultation progresses, the platform highlights possible explanations for the doctor to consider. Throughout the consultation, Dr. Leone follows every step in real time. But Prime is much more than a Zoom call.
When you're Zoom calling your doctor, if the patient says that they have a tight chest or they have painful ear, the doctor can't do anything. They can't listen, they can't hear, they can't see. This just allows the nurse to be the hands of the doctor.
On a personal note, though, it sounds like Prime must feel very empowering and liberating for yourself as a clinician.
I feel like I can make decisions because sometimes I really feel like a mini doctor, like, because you get to learn.
And what do the patients call Prime?
The WhatsApp doctor.
And this WhatsApp doctor is very good at flagging mistakes. At Nokwanza's previous appointment, Prime picked up that she had unknowingly been prescribed the same medication repeatedly at other clinics where there was no oversight by a doctor.
So she was taking the same pill in 3 different boxes, so she was being overdosed.
Healthcare and being a doctor is more than just knowing your textbooks really well. It's responsibility and judgment and bedside manner. Would you want a computer to tell you that your mother just passed away? Medicine is deeply human. And, taking a doctor out, I don't think that's the future.
Today, Prime is operating in just 2 clinics, but with 9 more launching this month, a technology born in the Free State could soon help bring doctors to some of the most remote corners of our country.
Remember, if you missed any of tonight's stories, you can always find us on the DSTV stream